Good day, everyone, and welcome to another enlightening episode of Synapse NG, where science, health, innovation, and society intersect. Today's discussion focuses on a very important subject in modern public health, epidemiology, and responsible conduct in research ethics. In an age where disease outbreaks, public health emergencies, vaccines, and health data shape global conversations, the need for credible research and ethical scientific practices has never been more critical. Today on Synapse NG, we host Stephen Aloko, an accomplished epidemiologist, public health researcher, and bioethics scholar with over 14 years of experience in disease surveillance, monitoring and evaluation, data analysis, and community health engagement. He currently serves as a chief scientific officer at the National Biotechnology Research and Development Agency, where he trains epidemiology, biostatistics, and biomedical ethics in research. His work spans infectious diseases, food safety, public health informatics, and responsible conduct in research. Stephen is also pursuing a PhD in bioethics and medical humanities at the prestigious University of Ibadan, with a strong passion for strengthening ethical standards and evidence based public health systems in Nigeria. It's a pleasure to have you on the show today, Mr. Stephen.
Good day, viewers. It's my pleasure to be here to speak with you.
Now, to begin, what exactly is epidemiology and why is it important in protecting public health?
What is epidemiology? It is the study of the distribution and determinant of disease and health-related events in a specified population and the application of that study to tackle the health problem. When we talk of distribution, we are talking of the frequency and pattern of the problem of the disease. And then when we talk of determinant, the predisposing factor that make that population susceptible to that disease. For instance, smoking, it has been established that it's a predisposing factor to lung cancer. So it makes smokers susceptible to lung cancer. And then the population, usually human beings. So public health is a population study, not an individual study. It's a population study. From that population, you take your sample size, which is a representative of the population size. Then the application of your result also matters, because that's the end point. Whatever you get, how do you apply it to tackle this health or disease and the health problem or disease? And why is epidemiology important to public health? In fact, epidemiology is the backbone of public health. It's data driven. Other branches rely on it. Branches like public health nutrition, environmental health, health economics, biostatistics, health policy, reproductive health. They all rely on epidemiology. Epidemiology and biotechnology, they are also related. For instance, the biotech company produced the vaccine. Let's take, for instance, the polio vaccine. But an epidemiologist apply the vaccine on the field, get results, publish it. The biotechnology company will now see the result and know if their vaccine is viable or not. So it's very, very relevant and important to public health.
Thank you. Now, how does responsible conduct in research influence credibility of public health studies?
Okay, responsible conduct in research in public health, how it affects the credibility of the result. Responsible conduct in research meaning keeping to professional norms in research that makes our research credible, that makes it acceptable. These professional norms include integrity. The researcher must have integrity in his research work. He must report every step he or she is taking. Nothing should be hidden. Another thing that the researcher must be transparent. It must be transparent in its methodology. Every step should be documented. Should be documented. All the data the researcher has gotten should be well written. Should not be falsified. Should not be fabricated. There should be no plagiarism. And then conflict of interest should also be mentioned if there is or if there is none. So all these are responsible conduct and research that make our research credible in public health.
Thank you, sir. Now, in your experience, what are the most common ethical mistakes researchers make in public health research?
Yes, ethical mistakes in research, in public health research. I've mentioned some. These ethical mistakes come among researchers. Number one, data falsification. Data falsification is when a researcher gets a result and maybe the result doesn't conform with previous research. He or she start manipulating the data to conform with previous results. That data falsification. Leave your data the way it is. It's even possible your result is the best. That is correct. So data falsification is an ethical mistake. Another ethical mistake in research is data fabrication. In this sense, data is never existing. The person sits in the comfort of his home and start writing data that are not existing. Is data fabrication. Then we also have not taking informed consent from your subjects, human subjects. You need to take their consent. For those below 18, their parents or guardians should give the consent. 18 and above should give consent for themselves. Explain to them the objective of your research. If they are willing, they join the research. If they are not willing, they leave. You can't force them. So informed consent is also important. Another ethical mistakes that researchers make in public health is not is confidentiality problem. Your subjects, they are giving you information about their lives. You need to keep their information, their data secure. Secure their privacy. If some information leaks out, some subject can commit suicide. So that's why we need to keep the data of our subjects so that it will not be exposed. One of the ways you can keep the data of your subjects by giving them codes, so that nobody will identify your subjects. So these are common ethical mistakes made in public health research.
Awesome. Now, to the next question, Mr. Stephen. How can Nigeria strengthen ethical compliance and integrity in scientific and health research?
One of the ways we can strengthen ethical compliance in public health research is by, in our university curriculum, we should integrate ethics in our university curriculum, right from 100 level, 200 level, 300 level, 400 level, and so on. So that when they graduate and come back for postgraduate studies, it will not look strange to them what ethical study, research ethics, or responsible conduct in research. It will not look strange. So introducing it early, undergraduate, will strengthen ethical compliance in research. Another way to strengthen it is by punishing those practicing unethical research. They should be identified and punished so that it will serve as a deterrent to those practicing it. Another way we can strengthen ethical compliance in research, in the Ministry of Health, when you go to their website, there is a place here that you can learn ethical research ethics on their website. So I will advise researchers to go there and learn more about research ethics. Ministry of Health, go to the website, you will see it there. So online courses are there that will give us more knowledge about research ethics and responsible conduct in research. So these are the ways we can promote ethical compliance in public health research.
Okay. Now, if I may ask, what role does data accuracy and surveillance play during disease outbreaks and public health emergencies?
The role they play. Data accuracy is very, very important. Information gotten during this period will affect informed decisions, because from the result gotten from this research, that decisions will be made. So the data need to be accurate. That data accuracy is that it is the representation of what is on ground. That's data accuracy. Your data is representing what is on ground. We also have a data. Your data should be reliable. That is consistent. If that research is carried out by another person, that person should also get the result or something very close to the result you have. The data should also be complete, or the data set should be complete. This makes our data accurate, so that the right informed decision can be taken to tackle the health problem.
And this is my last question for this episode. Thank you, Mr. Stephen, for coming on the show. For young scientists and students interested in epidemiology and public health, what skills and values should they prioritize developing early?
For young scientists and students interested in public health, I will advise that they volunteer first. They volunteer for health bodies like World Health Organization, Red Cross, population health, and a lot like that. They gain experience, they are exposed to public health research, what public health is all about. When they gain that exposure, then they should learn how to use statistical tools for data analysis. We have statistical tools like SPSS, MS Excel, we have Stata, a lot of them. I remember when I worked with WHO on a research, I was exposed to ODK, Open Data Kit. Is a statistics tool for collecting data live from on the field. So I was exposed, and a lot of them like that. The experience was really great. So young researchers, students should volunteer, and then they should learn the rudiment of statistics. Mode, media we learn in secondary school. They should learn them. Then how to use graph, because when presenting on your slides, graph speaks more than written words. So they should learn how to represent their results using graph. Graph speaks more than words, and it attracts the attention of your audience. So they should volunteer, learn statistical tools, go to the world of statistics, and they will be very happy with that.
Wow, what an insightful and thought-provoking discussion this has been. Today's conversation has reminded us that public health research is not just about collecting data or publishing findings. It is about responsibility, integrity, accountability, and ultimately protecting human lives. We have learned that epidemiology plays a central role in understanding disease patterns and guiding health interventions, while ethical research practices ensure that science remains trustworthy and beneficial to society. On behalf of Synapse NG, I sincerely appreciate Stephen Aluko for sharing his knowledge, professional experience, and valuable perspectives with us today.
Thank you.
To our audience, thank you for joining us. Continue to stay informed, continue to ask critical questions, and continue to support ethical and evidence-based science for a healthier society. Until next time, this is Synapse NG, connecting science with society. Stay informed, stay healthy. Bye for now.